like to start with what is the story behind how Janitri took off and what is the problem that you're trying to solve?
Great. Simple questions for me. But thank you for inviting me again. And I always love sharing my journey because even if it may inspire one person, it will be really great. So I come from Alwar, very near to Jaipur, and till my class 12th I was there, and so during that time I used to see or hear a lot of problems which were related to healthcare and around family, neighborhood, friends and all. But probably as a child, those were just stories for me, right? I never thought how those can be solved, or are they really the big problem? Never seen there as a problem because your mind doesn't work in that way. But after when I got admitted into VIT Vellore for my bachelor's in electronics, I got a lot of exposure of technology there because it's a very big campus, a huge opportunity. Saw a lot of things happening on the technology side, and that is where I started connecting some dots. Here I used to see this problem, and this is the technology can solve that problem. So the dots have started connecting at least. Yes, through technology you can actually solve some problem. So during my bachelor's, I started doing something in robotics. That was the story. But at the end of the bachelor, I decided that healthcare is something which I can work on a lot, and I decided to go for masters in biomedical engineering. That gave me a good exposure of how to build a healthcare technology. Not really to validate problem, but how the body signal work, what kind of a sensors comes into picture, what is imaging, so all that thing, and how these technology can actually solve some healthcare problem. After that, when I was unclear what to do in terms of what is that problem I can solve through my entrepreneurial journey, that was not clear after my masters. And I've gone through a very interesting phase, which is called an immersion phase, in which what you do without having a solution in your mind. You just try to go on a field to find a problem. So that is what I have done almost for 1.5 years. Across India, I have visited more than 100 hospitals, sat down with gynecologists, pediatrician, expectant women, pregnant women, their family, and understood the whole journey of pregnancy, labor and newborn. And actually tried to understood why in this 21st century mother and newborns are still dying while giving birth. So I just tried to understand the problems of this whole 1,000-day journey, and then started narrowing down to one problem statement. And then when the problem statement was clear, then I have started Janitri. So problem validation is a very, very important part of your startup journey or your entrepreneurial journey. As an engineer or as an enthusiast, we always think about solution, and we try to push the solution to some problem, and that fires back. But the right way is that can you spend a lot of time on identifying the problem. That is what I have done, and that's how the journey started.
Right, so I completely agree with that. Okay, so I'd like to know what are the different kind of products that Janitri offers, and how do they differ from the traditional methods that are already being used and are still being used for that?
Yeah. So I tell you, when I was validating the whole 1,000-day journey, when I was trying to understand this whole 1,000-day journey problem, I came up with more than 200 problem statements, more than 200. And half of the problem statements was related to awareness, which I think as a technology startup, you don't want to solve it because already government, NGOs, United Nations, all these are doing that already. So you as a technology company, you want to solve some problem where you can build some technology to solve it. So from narrowing down to 200 problem statement to one problem statement, that was also a very interesting phase in terms of what factors we have considered and all. So ultimately, there are 4-5 factors we have considered. One is how big is the problem globally? Because out of 200 problem statement, there were a couple of problem statements which were the geography based. For example, I have spent a lot of time in the Northeast. So those problem statement was related to the Northeast, which again I have filtered it down. I don't want to solve this because I want to build a company which is solving some global problem. That problem should exist globally. So from that process, how big is the problem, whether we can develop the innovative solution or not, whether customer is ready to pay for this solution or not, and whether it can make an impact or not. These were the 4 major factors why I have considered when narrowing down from 200 problem statement to one problem statement. So that one problem statement started from a labor phase. Once a mother start getting the labor pain and she get admitted to the hospital. Now this hospital could be a PHC, or this hospital could be a CHC, district hospital, medical college, or any private hospital, which could be the premium Cloud9 motherhood, or it could be a small nursing home. So the problem what we saw that in this phase, which is a very critical phase of 48 hours, there are critical vitals monitoring has to be done, which includes heart rate of the baby, contraction, maternal heart rate. And we saw that as per the WHO protocol, this monitoring has to be happened so fetal distress can be prevented. But during my visit, I found that this monitoring is not happening. And the reason behind that, there was no product available in terms of which they can afford. And skill-wise also there was a problem. Staff nurse cannot use the existing product because they were too bulky and was not easy to use. And that is the problem statement I saw. And I saw the similar pattern in 100 facility. So that's how it's got validated. When I talk to 100 gynecologists, they say, yes, we don't have time to see the data. So I sit in OPD, I want to see the data on my phone or wherever I am. So existing traditional product was not giving it. They were printing it in a thermal paper. So this is how it got narrowed down into these small factors. And then when we have validated it, the solution was simple. The market need a solution which is affordable, fetal maternal monitoring device, which is easy to use, which can give remote monitoring to the doctor, and which can give automated alerts. So even before started the product development, these 4 things were clear. The product should have at least these 4 features. So hence we started from a labor monitoring product device. That was our first product, which was the patch-based product and talks to the app. So the placement was easy for nurse. It talks to the app, so the doctor can see the data remotely. Because it talks to the app, then automated alerts can come. So we started from it. But over the period of time, when we started developing it, and then after that, when we started selling it, and then your customer only tell you that okay, they need a product which can be also used in last trimester. So then we have introduced the product for last trimester, similar fetal monitor for last trimester. Then they said, okay, we also want to monitor shock index value after delivery. So we have then again introduced a product, shock index monitoring, which can help them in preventing postpartum hemorrhage. Then they said, we also want a smart fetal Doppler. Then we have introduced that. But as a company, our focus and vision will be to only solve the 1,000-day journey. That is the focus, and that's the product line which will keep coming. So very soon we are coming up in the newborn monitoring segment also.
Since since you've mentioned a few products, what is the approach towards their innovation?
So approach on a broader way, it is a problem validation extensively, which I have already told you that before even thinking about solution, go and meet the end stakeholder. Who are the end stakeholder? The staff nurse, gynecologist, for us specifically. It could be A&M, it could be Asha worker, it could be maternal health director sitting in a government office, it could be the reproductive child health officer of a district, right? So these are the stakeholders. So you have to go meet them, talk to them, understand their pain. So problem validation is the first key. Now you have validated a problem and you think that, okay, this is the solution which can solve this problem. So even before developing the product, you can sketch the product. It's called paper solution. You can just make a product on your PPT, on your paper, whatever is in your mind, just sketch it. And it's called the solution validation or the concept validation, where you again go back to the same stakeholder and say that, see, this is the problem you have told me. If I develop this for you, how it will help you and will you pay me? So this is called solution validation. And if that validation occurs, then you start developing the product. And even in that phase, you don't develop the ideal product, you develop the minimum viable product. And again go back to the same stakeholder and say, okay, you said that you like the concept, why don't you try this? Now we have developed something for this, why don't you try this and give us the feedback and do the clinical trial and do the clinical research. And then take real feedback, improve the product again and launch after the regulatory approval. So this is the cycle which we follow. And the first step is very crucial, understanding the problem statement.
So I completely agree with that. What are the key strategies that have contributed to the success of Janitri? And I believe there are solutions for both hospitals and mothers. So has the approach been any different or just the same?
No, I mean, see, both segments are different, definitely. And you can say that the mother segment for us is still a very, very early. I mean, we are still trying in that segment. But yes, our hospital segment definitely have grown. Our products are almost in 400 plus hospitals now, including India and outside. So yeah, both the segment is different because when you go to the hospital segment, your influencer and decision makers are different. For example, in our case, gynecologist is the influencer. If a gynecologist running her own nursing home, then he or she is also a decision maker and the same guy will also write the check. Now let's suppose a gynecologist is working in Fortis. So here the gynecologist becomes the influencer. But then you have to also talk to the management who writes the check. So there are two stakeholders, right, when you go and sell. Now let's suppose government. In government, let's talk about Rajasthan. So in Rajasthan, whoever is taking care of the maternal health, that guy become your influencer if you want to scale in government. And then your MD NHM becomes the person who approves it, right? So that is how the stakeholder equation works. And you should know very well what you have to tell to each stakeholder. Because maternal health director can say, I want to improve the outcome. So I want this feature because I want this. For MD NHM says, on my dashboard, I want to see this data because I will use this data for my policy making. So you have another component for him. There might be a politician involved who say, here, I want to do this because this will help me in my campaign, right? So These are the different stakeholders when you go. Now comes to the mother segment. Specifically in healthcare, even if you see this case, what we have realized that when we have directly approached mother, they are taking the seat back because every mother have their own gynecologist. So there is a one-on-one relation. And pregnancy and newborn is a very specific phase, very sensitive phase. So they take any decision based on their doctor. They ask everything from their doctor. So this becomes, to start with, this is not a B2C segment, this becomes a B2B2C segment where you also has to convince gynecologist that, okay, why don't you recommend this to your mother at home? Because the mother is going to ask their gynecologist. So for us, the mother segment is little early and we're still figuring out in terms of the business model, how it is going to be. It's going to be rental model, per day or service model, per test model. So there is a need here that we have already figured out at home monitoring, but we're just figuring out the business model and the execution. So as of today, we are giving to the doctor and asking them to recommend to the mother on a rental model. Because they don't need to buy the whole product and they don't need the product after delivery.
And what is the impact that the portable device solutions have been able to create in improving the maternal and child health? Any statistics that you could give us?
The portable.
As the remote patient monitoring devices that Janitri offers.
So it has multiple factors. One is that how easy to use it is for the staff nurse, because staff nurse is the one who is using the product ultimately on the mother and all. So have we made a device which are easy to use for the staff nurse? So that is one. Are we saving staff nurse the time? Are the staff nurses are happy to use the product? That is one factor. Then the second factor is, are we helping gynecologist or obstetrician in two ways? Either increasing their revenue or saving their time or improving their decision making. So there are three ways. So when gynecologists see the data remotely, and it not just the data, it comes with the automated interpretation. So there are two things which we are definitely doing here. We are saving their time because now they do not need to come again and again to the labor ward. And the automated interpretation improves their overall decision making. So that is something what's happening with the gynecologist. So hence this remote monitoring feature is helping in that way.
So what are your thoughts about the patient-centered healthcare in India that we are looking forward to? Like it is already been adopted in other countries, but what is your personal opinion about its status in India?
So I mean, we're still a little far in terms of that because we are definitely, dependent on doctors, hospitals, and all, and that is how this industry going on. So as a founder perspective, you always take decision which is going on as a student. You cannot go against that. Otherwise, it will go against you as a founder or as a company. See, I could say that this is definitely moving in that direction, and awareness is definitely going to play a major role in this. So it's a game of awareness rather than the game of technology or anything else. Because see, as of today, we also have a home monitoring solution for pregnant women. But how many pregnant women will use our product without even consulting their doctor, right? So it's a game of awareness, and so we as a company also now taking the tiny steps towards awareing the pregnant women that this is something what you can do to yourself. You can take your own decision based on this. You can reduce your cost to visit to the hospital setup. But there is another story that when you do that, and if you try to cut down the hospital revenue, then the doctors are against you. So it's a chicken and egg problem, and you have to solve it very carefully and very sensitively. But I would say that we are definitely moving. Insurance will definitely help in that direction, uh, and that is something what has helped the Western world.
Thanks. So I'm sure we have a lot of Shark Tank fans in the house, and they would love to know what your experience was like, and was there any change in your business model post that?
From the experience perspective, yes, definitely it's been a great journey after that. Every company or every startup keeps needing some sort of a kicks at every stage. So consider that that is one of the kick.
This is something that I'm really inquisitive to know. So, what advice would you give to your younger self when you started off a business? Is there anything that you feel that you could have done differently?
When I started off,
When you started off the business,
so I could have done differently.
anything that you feel now that could have been a little different?
I would say, see, I definitely, for example, I have not worked in corporate, right? Straight away after the college, with the passion, started this. So, in last 7 years, I have done a lot of mistakes in terms of development or regulatory approvals, or taking the funding or team. So, for example, we have developed our first minimum viable product without even considering its regulatory requirement. So that was one of the learning where we have lost a lot of months and the money. And then we realized that we have to build it again considering the regulatory requirement. So if I and then that is why one of the reasons then now our new products are coming up. The cycle is 2.5 years. I took for 5 years to bring my first product. Now it's 2.5 years. So it's almost reduced to half. Second is definitely till now I have not found my co-founder. So and very difficult to find very passionate people who are willing to give that sort of an energy. But if I can found that sort of a co-founder, tech co-founder or business co-founder, I would love to do that when I want to start again. So yeah, if anybody interested in co-founder, if you think you are willing to give your next 10-15 years without expecting anything, reach out to me.
I'm sure mistakes must have been a great learning experience. So, do you personally think that medtech startups face certain challenges in investments?
Yes, 100%. And simple reason is number one, the cycle from an idea to scale, the cycle is too long. The development cycle, the clinical trial cycle, the regulatory cycle, and then further scaling up, and mostly it is B2B. Investors don't like it. And see, ultimately, it's a cycle. See, look at me, it's been 7 years, and we are still at early phase of scale up, right? While they look something, okay, within a year you should be that much of crore company, and definitely that's possible when you are an internet idea or app-based idea or something which is an operation-based or service-based, which is possible. So hence, over the last 10-15 years in India, the investors also have gained that sort of a knowledge and that sort of an experience. So they even do not understand medtech or hardware. So there are very few investors who wants to come into this industry, and definitely there are investors not, because we have also raised fund. So there are people you just need to figure out, but from that big pool, there are only few. And the reason is very simple, they don't understand its own cycle, because this industry needs patience in terms of return. Right? It cannot come under 3 year, 4 year, it will take time. And hence they do not have understanding, and hence it will come. It will come because it has become mature in the Western world. There are many investors who are now supporting hardware or medtech there. So it will definitely come here, it's on the way. But I would say that if anybody wants to start, this is also a right time to start. Simple reason is there are many grants available to start with, because we also survived on the grants to initial 4 phase. Grants from Gates Foundation, which we got it, buyback, Government of India, Government of Karnataka, Government of Canada, many foundation, which can help you in generating your product, clinical trial, regulatory approval. And now I see that couple of angel investors have become active in this space. So a good time to start healthcare.
Thanks. And what is your leadership philosophy and how do you think it has evolved over the course of 7 years?
So I really believe in do early, fail early concept. So that is how you will keep evolving. Number 2 is definitely giving ownership to the team members, and really do not expect it they will not do mistakes. So, and I always tell them, fail early, do early, but early करो. ऐसा नहीं कि आप कोई experiment you are doing and then taking some decision after long time. So that is how you will keep evolving, whether it's a product or it's a learning or business model or regulatory or anything. That is how you will keep. So that is one of the big philosophy which really helped me a lot in last 7 years. Giving ownership to the fresher, young mind. Because a lot of time we think that okay, if a freshers join out of the college, should we really give an ownership or not, end to end? But I think we should, because ultimately what they will do, probably they will do a mistake, right? And but if somebody can early identify that mistake and rectify it, that's a good thing. But the energy is super high, so I'm a big believer of having the very young team around me, not really very experienced people, because they have a great energy, great enthusiasm, good ideas, and that is what a startup always needs.
Sure, many of us are happy to hear that.
Yeah.
So with the coming of the IoT, artificial intelligence, machine learning, what do you think is the importance of innovation in the healthcare industry? Although we've partially discussed this in terms of more awareness being needed for this, but what do you think is needed more other than awareness?
So from the IoT AI/ML technology perspective, it is one of the pillar which is going to change the healthcare industry, or which is definitely going to help the healthcare industry in terms of improving the efficiency, in terms of reducing the cost. See, for example, let's take an India example. We always say that, right? The doctor versus patient ratio is very less. The staff nurses versus patient ratio is very less. So one way to think about this just as a problem, and second way to think about as an opportunity. So suddenly you cannot solve the ratio problem. You cannot bring a lot of doctor, a lot of patients suddenly, right? That will probably keep happen over the few time, or probably will not happen. So how you can solve these through technology? So can I actually increase the productivity of my staff nurse by providing some technology? Can I increase efficiency? Can I increase the decision making by AI/ML? Can I reduce my doctor's time? The doctor used to see 10 MRI report in 1 hour. Can I give them the AI/ML based report, or can the doctor see 50 reports in 1 hour? So this is how technology or as a startup you can think of, by making sure that how you can fit in the existing ecosystem from these factors, in reducing cost, increasing efficiency, productivity, or decision making.
Since you've met a lot of doctors during this journey, but do you think they're accepting technology as such? Because a lot of studies show that they're not open to using technology in their practice.
No, you are absolutely right, but it's a little bit problem with the old doctor, not really with the young ones. But here also I have one learning in last 7 years I can share. So it's about, for example, when there is let's suppose they are using something, some way of doing, and suddenly they see a technology where they see the huge shift, that is where they have that resistance. So my learning is from the startup point of view and from the innovation point of view, from the adaptability point of view, we call it as an incremental innovation. So try to find out what are they doing now, how they are doing now. See, as an engineer, you might think the ideal solution, ठीक है वो आ जाएगा, but can you think of a intermediary solution which are the incremental innovation on the base? You know, go to them with that incremental innovation. He said, देखो अभी you are using that. Now we have come up with this another one more thing which is just an incremental one. They will not hesitate. And then slowly upgrade them. Suddenly एक बार आप जाओगे ना कि सर आप अभी तक फोन यूज कर रहे थे, वो वैसा करो, अब सब कुछ हवा में रहेगा. They will resist. So just think on that perspective also when you're thinking, building any idea or product. Can we go and show them? I'll take my example. So fetal monitor, they since last 30-40 years they are aware about the Doppler and Toco based technology which monitors fetal heart rate, Doppler, and Toco monitors contraction. We made a patch which completely works on the ECG and EMG principle which they have never heard about. So that is one thing. And it also works with mobile application which also they have never used in their life with the traditional monitor. So altogether that becomes too hi-fi for them. And when we started selling, we realized that there was nothing wrong in our product. But when we started selling, we realized that there is a resistance here. So what we did, we took the intermediary step. We took the traditional sensor, made them wireless, made that communicate to the mobile app. So that becomes the intermediary step to step in. Dekho, the technology is same. It's the same sensor which you use, Doppler and Toco, but we have made that wireless and it just talks to mobile app. Now they are okay, let us try. So, that is something, one of the learning I had personally in last 7 years. And I think I will keep applying for my upcoming products. Just give them the first incremental innovation and then keep incrementing it. Yeah.
Looking ahead, what are your future goals for Janitri? And do you also plan to diversify into other products other than maternal and child health?
No, as of today, we have not thought other than mother and child healthcare, but we have only thought about this 1,000 days journey, which is very well proven from WHO or big health organization like the whole pregnancy, labor, and a newborn up to 2-year-old. It's a 1,000 days journey, which is very sensitive, very critical. Lot of mortality and morbidities takes place in this 1,000 days journey. So as a company, we will keep bringing products specifically from the critical vitals monitoring side and smart, like app-based, plus AI/ML based decision making on top of that data. So that will be our technology front, but for 1,000 days journey. So it might be, let's suppose a hypertensive patient during pregnancy might need a BP monitor, but we will give them the smart BP monitor with some sort of an automated interpretation and early decision making, because that is one of the factors. It might be a diabetic pregnancy, we might give them a glucose meter, smart glucometer, but we will be only focus on some vital monitoring and early decision making. That will be our focus.
So if not the amalgamation of medicine and engineering, what do you think you'd be doing? Any other career that you ever had?
I don't know, never thought, but probably some sort of an artist in music. Never tried, but never thought in that direction. Probably will get to know in future.
Thank you, sir. It was great interacting with you.